I'm doing the first aid lecture. Has nothing to do with anything with robotics. Just a quick one. You guys are working with heavy machinery. All right. If one of you lobs off a finger, everyone shouldn't just be letting them bleed out. All right. That's all this is here for. It's nothing crazy. Not expecting you guys to do anything. In case any of you guys are unaware, professionally, I've been an EMT for like 5 years, peds emergency nurse, adult emergency nurse. That's pretty much it. So without further ado, we'll go ahead. So little slogan here, blood goes round and round, air goes in and out. Any deviation is a problem, okay? So real quick, just to understand basic anatomy for emergencies, for particularly injuries. We have a heart, obviously. Well, some of us. Hit or miss with some of you guys. But we have a heart, all right? Heart pumps out to your arteries really strong, really fast. That's your pulse that you feel in your wrist or here or in a bunch of other places. You can feel your arteries pulsing. That's the high pressure coming directly out of your heart through those big arteries, okay? Once it's gone to your cells, perfused you, gotten oxygen to you, it goes right back to your heart, but through a much slower process through your veins, which would be these little blue ones here. Your veins, all the guys work out so that they can show them to the ladies. The blue things on your arms. They don't have a pulse, right? You feel your vein? No pulse. Shouldn't be. That's what your arteries are for, okay? So, yeah, that's all that is for that. All right. Two main things to worry about that stop blood from going around and perfusing you. Losing a lot of blood. Obviously, if you don't have enough blood, your body can't pump it to get you the oxygen that your tissue has to have, or else it'll die. The other one is your heart stopping. Cardiac arrest, although this is a funny picture, that's more of a heart attack. Cardiac arrest, for whatever reason, your heart has stopped. Whether it's because you lost too much blood, you weren't breathing, anything. Your heart has stopped for some reason. That's all cardiac arrest means. Your heart has arrested, okay? And that is a problem because you need your blood. All right, so real quick, types of bleeding. Not super important for you guys to know, but you get a little nick on your hand, that's a capillary bleed. There's no big vessels involved. You get a really deep gash, you maybe hit a big vein. That would be a venous bleed. It'll be slow, darker, and then if you see blood spurting, so every time the heart beats, it's spurting out of them, that's an arterial bleed. That's the most concerning. Venous bleeds can also be very serious, depending on how big they are, but this one's the big concerning one. If you're seeing this, and it's coming out of a big section of somebody's body, not their finger or something, you probably need to get a tourniquet on or something quickly, or else they could die, okay? So how to stop bleeding. The first thing you do, you don't have to have a bandage, you don't have to have anything at your own risk, it's somebody else's blood. But first thing you can do it with a bare hand if you don't have anything, a cloth, whatever. It doesn't matter if it's clean. They can clean it out at the hospital and make sure there's no infection. The first thing you do is apply pressure, okay? And even if you have a little nick on your finger, it'll keep bleeding if it's deep enough. Just hold it real tight. Like it's just like a basic thing. Even if it's just like a non-serious cut, you're not going to bleed as long if you just, and I'm not talking like, oh, I'm holding pressure. If you hold pressure correctly, the person that you're holding pressure on does not like it. All right, they will be in a serious, when they're like altered and stuff, they'll be trying to kick you off of them. Like if you're holding pressure right, you should be putting like, you all weigh like nothing, all of your weight on the serious bleed, okay? Like if somebody's seriously injured, you should be like, in a shooting scenario, like you're taught to like kneel on like the wound. Like that's how much weight you're supposed to put, so. But if pressure doesn't work, and we don't need that because you guys shouldn't be doing that. Pressure doesn't work, the next thing you can go for, if it's on an extremity, do not tourniquet somebody's neck. You're not going to be able to tourniquet their stomach. Best you can do is hold pressure. But if it's on an arm, say somebody lobs off an arm, finger, whatever, it's bleeding a lot. Next thing you can do is try a tourniquet, okay? So I'll give this out. You guys can pass it around. This is what we have in the shop. It is a knockoff version of a cat tourniquet, which is like the most common kind. So once again, like the pressure, this is meant to cut off all circulation to the extremity. People try and rip these off, even though they have like severe arterial bleeds. That's how bad they should hurt, okay? So you shouldn't be worried about hurting the person. If you think you need a tourniquet, it needs to be there, and you should be clamping it down all the way, okay? So it's really simple. These ones, that's why I got this one. And if I'm gonna buy another one that's wrapped, because we shouldn't have it open really in the shop, but I'll leave this one in the shop for people to practice with if they want. But it's really simple. It's a Velcro strap, just goes through. And if you have like an arm or something, and then this is important. If you're doing a tourniquet on yourself, you keep the red towards you, okay? If I were to be doing this on somebody else, I would turn it, flip it away from me, okay? And that's just so you can get the best leverage to get that full pressure. But you would pull it as tight as you possibly can here. And then once you Velcro it down, then you take this to clamp it down further and keep twisting. And you'll know you've gotten it right if you can't feel your pulse anymore. That's how, like if you're practicing the shop, you shouldn't be able to feel your pulse when you're done, because there shouldn't be any blood going to the extremity, okay? And it's not going to lose the limb. It takes like 14 hours to lose the limb, all right? They'll get to a hospital before then and get taken care of. You can leave a tourniquet on a long time. It just hurts, okay? Once you've applied a tourniquet, do not take it off for any reason. If you find that you need another, it's not stopping the blood, you apply a second tourniquet right next to it, okay? So you guys can look at it if you want, okay? And then talk a little bit about bandaging. Bandaging with anything first aid oriented, it's a practice thing. So if you want to be good at bandaging or good at doing something, practice, know what's in your kit. For robotics purposes, we have a bunch of stuff, but your basics of any bandaging kit would be just a simple 4x4 and cling gauze, okay? And I'm going to pass these around, and I'll have you guys partner up and practice, just like a basic pressure dressing. Bandaging doesn't have to look nice. Once again, if somebody has a serious bleed that you're concerned about, they will go to the hospital. The hospital will take care of them, get it clean, get them sorted, okay? So we're not worried about that. We're just worried at stopping the bleed, okay? So it doesn't have to look nice, just has to work. And there are people who like do all kinds of wacky stuff with bandaging, learn all kinds of different techniques, and those aren't bad. But like, for you guys, just at least know how to tie a bandage around someone. Okay, so this is your cling gauze, okay? Just simple roller gauze. Soft, it's all it is. It doesn't stick, it's not sticky or anything, okay? And then, so this would be in a situation, I'm holding pressure, I've gotten the bleed to stop, I'm not ripping this off because that will open up all the clots and cause them to bleed again. I'm keeping it here, and then I'm like, I don't need to hold pressure, I can put a pressure dressing on, which is just hard to do on myself. Give me your arm, Adi. But it's just as tight as you can. Once again, it'll hurt if you're doing it correctly. Not a ton, this isn't as tight as a tourniquet, but it'll hurt, and you'll just go as tight as you can. Use the entire roll. It's not, once again, doesn't have to look pretty, but you use the entire roll, and then either tuck it away somewhere once you're done, and find some way to tie it securely so that it doesn't come back off, okay? Because once again, and then once you've put any kind of dressing on somebody, it's the same as tourniquets. You don't take it off for any reason. If it's a serious bleed, you leave that there. Because every time you take it off, you cause more bleeding. It'll rip the clots back open. If you find it's not stopping the bleed, you take something and you tie it even tighter around, or you put something even tighter. next to it. You don't take it off and put a new thing on, okay? All right, we'll go back and practice with these. I just want to make sure we have enough time, so I'm going to go through the slides the rest of the way. All right, other big things. So the big things I'm worried about you guys for the shop is bleeding, okay? So that's why we talked about that so much. And the other thing is just simple cardiac arrest, which is, as I said earlier, just the heart stopping, okay? Yes, I have the little clip from the office. But that's, so cardiac arrest, once again, it doesn't have to be a sudden heart attack. It can be, right? Person can suddenly collapse. It could be somebody bled out. It could be anything, okay? But it's the heart stopped. So no blood going to the brain. Brain can't go more than like 10 minutes without blood, and like more than 3 minutes without permanent brain damage. So that's why this is so important, because lots of people die because they go into cardiac arrest and nobody near them knows CPR. When if they had started CPR immediately and then, you know, held them over till the ambulance got there, they would have had a better outcome, okay? Okay, so what causes cardiac arrest? Already kind of said that. Anything that could kill a person, right? So the first thing, what's going to make you suspect, right? If I'm in cardiac arrest, am I talking to you? Anybody think I'm talking to you? No. Okay, good. Yeah, I am dead, right? For all intents and purposes. Heart is stopped, okay? So if somebody is down on the ground, unconscious, whatever, suddenly collapses, maybe they're having a seizure, maybe they're whatever, if they are not talking to you, that is an appropriate time to check a pulse and see if they still have their heart beating. Not this pulse. This pulse goes away long before this pulse does, okay? So you're checking up here, same side that you're on. So in the movies, you always see they cross the neck. You don't cross the neck, same side you're on, okay? So if I'm sitting on this side of me, I'm checking here. Okay, you start on your trachea, right here in the center of your throat. You slide your fingers down into the little crevice here. You can feel it on yourself, you can feel it on other people. Once again, feeling for a pulse is something that you practice. So, you know, if you just feel it on yourself, you'll kind of know where it is on other people. Okay? You check that for 10 seconds. If you're not feeling anything, their heart could still be beating a little bit. It doesn't matter, because if we're not feeling a pulse here, where is blood not going? Brain. Okay? So they need an intervention. Okay? They need somebody to pump their blood for them until we can get the heart started again. Okay? Because that's all that CPR is. CPR is just keeping the blood pumping as a placeholder till we do things that will get the heart started again. Okay? This is hand placement for CPR. I'm going to get some billboards up in the shop because you guys aren't going to remember this without doing CPR. You're never going to remember this. I just hope maybe it sticks in the back of your brain somewhere, okay? But hand placement, it's right over here, in line with, your hand should be like center of the nipple line, okay? So if you see this guy's middle finger runs right through the nipple line. Okay, so that's where you want to go. It's hard, it's 3 inches, 100 to 120 times a minute. So they always say staying alive, but there are plenty of songs that are that fast. It's pretty fast, but you would be surprised. Most people with their adrenaline running want to go faster than they should. If you go too fast, the blood doesn't pump correctly. So just try and stay in that range. You could always use a metronome. If you guys are doing CPR at all, I'm happy. Okay, if somebody were to go down in the shop. 120 times a minute, Baby Shark, 2.4 inches. Yeah. Okay, AED. Without you guys taking CPR, I'm not going to go into crazy detail about the AED. Just know that it's there. It's up on the wall in this hallway here. If somebody does have an emergency, and like I'm not here and I'm hoping to get some of the mentors CPR certified, and she works in a hospital, I still encourage you to grab it They are made for people to be as dumb as possible and still be able to operate them. You open it, and it tells you word by word with pictures what to do. All right, it's like impossible to mess up. And the other thing is when we're talking about injuring somebody with CPR or assault or anything like that, you're covered by Good Samaritan laws. So basically, if somebody needs CPR and you're doing CPR, first of all, ribs always fracture in CPR. You feel cracking if you do CPR correctly. Okay, so start with that. But also, they can't sue you. You are covered by those laws. They are dead. All right, I don't care what you're doing, probably isn't going to be worse than nothing. Okay, so, that's why I'm going to put the bill. You guys won't have had practice, and practice is the best thing. But I am going to put the billboards up on the thing, up on the wall. Okay, if somebody goes down in the shop, look at it, place your hand correctly, and start, okay? The AHA, American Heart Association, now just suggests for bystanders hands-only CPR because people were always confused about the breathing versus the mouth-to-mouth, all that stuff. All stuff that you do if you're a trained professional, but it's not as important as just doing the compressions, just hitting the chest, okay? That is the most important thing you could possibly do. And that is all I have to say about that. CPR example. Let me see if this video is any good. I don't know, it's from last year. Nope. Let's just see here. Let's see. 12 and older, so that would be an adult size. That's her checking for responsiveness, checking a pulse. Okay. Okay, and you could even go deeper than that. That's kind of a light compression, but that is what it should look like. Okay. Once again, practice is the best thing. Doing it, right, is the best thing. And if you guys are interested in getting CPR certified, I can point you to the directions for like the website and stuff, but that's besides the point. I don't know how to put it back in presentation mode. On the right? Thank you. Okay, as I said earlier, they're not getting any deader. If somebody has no pulse and they are on the ground, do CPR, okay? Hands only, just do hands only CPR. You're not gonna hurt them, they're dead, okay? Just do it. Because the ambulance will get there and then they might actually have a chance of making it, okay? Yeah, I don't know why I put this up here. And this is an airway, which is cool and all, but I don't. Well, we'll talk about choking real quick, and I'll use this picture. So choking, okay. I will show you the Heimlich maneuver, but choking in itself, what does somebody look like when they're choking?
Their face gets all red and purple.
Okay.
Reaching for their throat. They can't speak.
They reach for their throat.
Okay, so universal choking sign. So if any of you are choking, do this, all right? It used to be this, but they changed it for a few different reasons. Universal choking sign. If somebody is coughing, hacking up a lung, yes, it might have gone down into this airway a second and popped back up, but if they're coughing, what do you move out of your lungs when you cough? Air. Okay, they're moving air. They're okay. Maybe they need to go to the hospital, but they're not dying right now, okay? If they're hacking up a lung. It's not that big of a concern, which sounds terrible. Because people are always like, oh, you're a nurse. And I'm like, yeah, they're moving air. All right, if somebody is choking, the item is most likely All right, so you have your nose, nasal cavity, and the nasal pharynx, oropharynx. The item is probably not actually down in the wrong tube, but blocking both tubes. So it's probably blocking both your esophagus, your food tube, and your air tube. And it's probably just sitting right here. So our goal with the Heimlich maneuver is just to like blow enough air back out the lungs to kind of just pop it back up. That's all we're trying to do when we do the Heimlich maneuver, okay? Once again, one of those things that if somebody is not able to move air and not talking to you, and they're doing the universal choking sign, all right, they got like maybe a minute before they're down on the ground. If you go and you break a rib or mess up an organ or bruise an organ, it's worth it, okay? You're not gonna kill them by doing the Heimlich maneuver, and if you injure them, it's still better that you did that than just like let them choke and die, okay? That we're not gonna go over. Splinting, it's not worth going over. Let me just show you the Heimlich maneuver. Let me find a video. Let me just, Mayo Clinic, they should be reputable. We don't need this scenario, and we don't need that. I need hand positioning.
That should show you. That should show you.
And that's not correct. Okay. Well, I'll just tell you guys. So it's literally you take both hands and you like make a fist, however's most comfortable, okay? You make a fist. All right. You put it right above their belly button, the umbilical area, roughly. Once again, this isn't an exact science. You're literally just trying to create pressure in the lungs and the diaphragm to pop the food back out, okay? And then you literally just like a kind of upward with all your might, just kind of slam their belly, okay? And it'll hopefully pop out the food before they go down and unconscious. If not, you're supposed to, that's a whole nother thing that I'm not gonna go over. So, that is all I have other than practicing bandaging. I just want you all to tie at least one Band-Aid, just so you can kind of feel what it feels like. So pick a partner, buddy up, pass it down. And then Seth's gonna talk to you. Huh?